Good day everyone, I am Miriam Hernandez from Upgrade. I am here to present to you the 2x2 variable scenarios of Quezon City by the year 2050 from the Drug Demand Reduction Group. Illegal substance use has long been a problem in the Philippines. Given the geographical location of the country, it is considered a regional transshipment and destination point of illegal drugs. According to a 2019 report released by the Dangerous Drugs Board of the Philippines, there are currently 1.67 million Filipino drug users. When the incumbent Philippine President Rodrigo R. Duterte assumed office in 2016, his government launched an unprecedented campaign against illegal drugs. The drug problem in the Philippines has primarily been viewed as an issue of law enforcement and criminality, and the government has focused on implementing a policy of criminalization and punishment. The Philippine Drug Enforcement Agency or PDEA in 2017 revealed that at present, out of 42,036 barangays in the country, 49.65% are considered drug affected. In this 49.65%, the National Capital Region has the highest rate of barangay drug affectation with 96.48%. With this, will it still be possible to have safer, healthier, and drug-free communities? What future scenarios await our country? We can only imagine. Various local government units have started to formulate their own strategies in combating illegal drug use within their jurisdictions. In Quezon City, treatment and rehabilitation have been one of their priorities. However, the city government's rehab center can only accommodate a limited number of patients, making it impossible for all to be accommodated due to the large number of surrenderies. On the other hand, the QCLGO also makes sure that the drug abuse within their community will be lessened through education and advocacies. The Quezon City Anti-Drug Abuse Advisory Council or CADAC is leading the initiative in conducting an illegal drugs education program in both elementary and high schools in the city and in the barangays through their Masa Masid program. But because of the COVID-19 pandemic and the added mobility restrictions to ensure proper observance of minimum public health standards, CADAC admitted that the implementation of such programs became more challenging. So what if these problems persist until the year 2050? Or what if this gets solved? So here we have the 4 future scenarios. The first one is entitled the ambulance service. This phrase means that something is helpful only after one is already injured or in trouble. The idea is that while an ambulance at the bottom of a cliff can help people who fall off the cliff, a fence at the top would be more beneficial. Just like the status quo, while the government is busy punishing and criminalizing drug users in our society, the real root cause of the problem remains unsolved. The punishments and sanctions imposed are basically useless because drug addiction is a symptom of a more complicated illness, which is poverty, that is prevalent in the Philippines. So is there a way to turn this around? Scenario number 2, entitled Teamwork Makes the Dream Work, says yes. When there is a collaboration among various sectors in the society, there would be harmony. Imagining a drug-free community may be a little strange for some, but definitely achievable. We know that drug abuse is a multi-sectoral issue. Therefore, there is a need to identify the key factors in order to lay down policy solutions and recommendations that is recognize the need for more inclusive, humane, and sustainable programs, projects, and policies that are beneficial for the community. Through the interviews and brown bag discussion that our team conducted with various stakeholders, envisioning a safer, healthier, and drug-free Quezon City community can now be a reality. Imagine a QC where each and every citizen is given immediate support for their physical, social, and mental health. There are continuous and long-term programs for health assessment as well as mandatory illegal substance use tests in order to ensure that the health inequalities are addressed as well as combating the use of illegal substances. All programs related to health and social welfare are individualized to meet the varying needs of every citizen and address the gaps of inequality. Early prevention and treatment intervention measures are at play when it comes to preventing substance use and abuse. Such programs are people-centered where the focus is to save lives and their futures. From the high-rise metropolitans to the local community centers, people are educated about the implications of substance use and are empowered to promote constructive lifestyle and norms that discourage all forms of illegal substance use. Quezon City's treatment and rehabilitation for drug dependents is at best where the best principles and practices are at the forefront of health and social welfare programs. The youth of Quezon City takes charge of the community-based initiatives on developing and implementing strategies to influence their generation to choose a safe and healthy lifestyle away and without the use of illegal substances. There is also a great dynamic and powerful linkage in terms of institutionalizing policy frameworks and structures with key stakeholders such as the academe, non-government organizations, national government head agencies, and community-led entities who are part of a larger goal of destigmatizing substance use. All Quezon City citizens are able to live in a healthy community composed of resilient, adaptive, and vision-oriented people. All Quezon City citizens are living in a safe, healthy, and drug-free community that is sustainable, adequate, and people-centered. Third scenario would be doomsday. From the title itself, one can imagine the chaos it would bring. There would be no collaboration at all among various key stakeholders. Drug abuse is often accompanied by a devastating social impact upon community life. The negative consequences of drug abuse not only affect individuals but also their families, friends, various businesses, and government resources. Economically, drug abuse by an individual manifests itself in prevention and treatment costs, healthcare and hospital costs, and increased morbidity and mortality. Beyond health costs, people under the influence of drugs pose major safety risks around the people and its environment. In addition, crime committed under the influence of drugs is a major problem worldwide, with news reports of drug-related crimes not being new to us here in the country. Another is the impact of substance abuse on an individual's productivity. So, studies have put the costs of lost productivity borne by employers at tens of billions of dollars. Imagine a poverty-stricken Quezon City plagued by various problems related to health, education, and peace and security. Last scenario, entitled Almost There, describes a Quezon City that has made a little to no progress despite and because of the failure of the national government to address the problem. Progress is seen because of the co-innovation done by the QCLGU and its partner universities and other educational institutions in the academe. However, problems like lack of funding for both the LGU's projects and initiatives and the university's research projects will arise, and the problem of illegal drugs will continue to persist because the national government failed to do their part. In this, the importance of having a solid partnership is highlighted. As Filipinos, it is included in our responsibility to contribute in building a better nation. There sure are challenges and obstacles present today and in the future, but together working towards a healthier and drug-free Philippines is possible.